Welcome. It's just turned 7 o'clock, so in keeping with being on time and appreciating that everyone's really busy, we'll get started. So my name's Katie Pryor. I'm the Manager of the Education Programs here at the Western New South Wales PHN, and I'm really pleased to welcome you tonight to our mini learning set for general practice on establishing a vaccination clinic for the COVID-19 vaccination rollout. I would like to start tonight's meeting by acknowledging the people of the Wiradjuri Nation and the different nations on which people here sit tonight. I would like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations and pay respect to elders past, present and emerging, and acknowledge their continuing connection to land, water and culture, and for their contribution to help shape the life of the communities in which we all work and live. We are committed to working in the spirit of partnership and collaboration with our region's Aboriginal communities and peoples to improve their health, emotional and social wellbeing. I warmly welcome Aboriginal and Torres Strait Islander Australians who are present in this meeting this evening. We'll just move on to some housekeeping, but first I'll introduce you. Tonight will be facilitated by Tabitha Jones, who is the Western New South Wales PHN COVID-19 Response Coordinator. Tabitha will be joined by a panel from the PHN. We've got Josh Costa, who is our Primary Health Program Coordinator, Michelle Drulers, who's our Immunisation and Cancer Screening Coordinator, Fallon Gray, who's the Manager of Practice Support and Improvements, and Claire Trott, the Manager of Digital Health. Now we'll get to the housekeeping. As most of you have done, if you can just pop your name in the chat box, really just so we can track attendance, we'd really appreciate that. If everybody can make sure they stay on mute throughout, just to avoid any noise interference. And if you do have questions, which I'm sure you all will, probably the preference is to type those questions into the chat box and we'll address those towards the end of the session. If you do wish to speak in a break, unmute yourself and just identify who you are so we know who we're talking to and we can respond to you that way. And I will now pass over to Tabitha to get us started. Thanks, Tab.
Thank you, Katie. And I'd just like to start by welcoming everybody as well. We know that you're busy setting up your vaccination clinics, but we have been receiving a lot of inquiries and requests around where people should start and how they can set their clinic up and where to go for information. So the idea of tonight is to pull together some of the people within the PHN who can help you and to give you an idea, I guess, of where you can start, but also some resources and some contacts so that if there's things we don't answer or there's questions that you still have, you can by all means get in contact and we can support you through this process, because we know that it's new and we know that it's a big process for everyone, and we're really grateful for everyone who's putting their time and energy into this. So we will get to questions at the end, because I'm hoping that we will potentially answer some of your questions as we go through. And so we will have a look at the questions at the end and try to get the panel to answer those as well as best that we can. So let's start by talking about what is happening with the rollout for general practice. So primary care, so general practice, our Aboriginal medical services and our GP respiratory clinics fall into stage 1B of the vaccination rollout. So stage 1B is really looking at vaccinating some of our vulnerable population. That includes our elderly adults, our healthcare workers, our Aboriginal and Torres Strait Islander people, and people with underlying medical conditions. And there's just a link there that you can send patients to or your staff to have a look at who's eligible for vaccination in each stage of the rollout. And this is going to be a question that you're probably going to be asked a lot over the coming weeks and months. What I would just like to do is introduce Josh Costa to you. So he's working with us in our Aboriginal Health and Wellbeing team, and he's going to talk a little bit about Aboriginal vaccination, why it's so important that we try and encourage and also protect our Aboriginal population through vaccinations. Thanks, Josh.
Hello, everybody. So my name's Joshua Costa. I'm the Primary Health Program Coordinator here with the Western New South Wales PHN. I'm an Aboriginal man from the Jabbergai tribe up in far north Queensland, but I grew up here in Dubbo in Wiradjuri country. Yeah, so in regards to the vaccination, so when it comes to, so it's self-identification will be accepted for this vaccination. There will be no further proof needed of Aboriginal identity, such as like proof of Aboriginality and other forms of that to receive the vaccine. So we'll be, yeah, I've got a little clip here. It's actually a radio interview with Dr. Jason Agostino. That's the link to that. That's actually really informative around a lot of what's happening within the Aboriginal and Torres Strait Islander communities with this 1B rollout. Just go to the next slide. Yeah, so phase 1B will be for Aboriginal and Torres Strait Islander people who are 55 years and over that have a chronic medical condition or conditions, and high-risk workers such as frontline health workers, so if they're working in the health sector, like at hospitals and things like that, as nurses and other professions in that space. Then phase 2BA will be Aboriginal and Torres Strait Islander people from the ages of 18 to 54 years. Phase 3 will be under 18 years of age. 40% of the Aboriginal and Torres Strait Islander population is under 18 years of age. Vaccination for this age group will probably be close towards the end of the year. There's also a YouTube clip that is linked in with the community engagement kit that I've put there as well within the slides. There's a hyperlink, you just click on it when you get a copy of these slides. Currently there have been no deaths recorded in the Aboriginal and Torres Strait Islander community from COVID-19, which is great. So I'd like to keep that up. But it is also estimated that we'll have to continue social distancing and the proper hand hygiene for at least the next 12 months, and regardless of whether you've received the vaccine or not anyway. But yes, well, that's my bit done, I think.
Thank you, Josh.
No worries, Tab.
So I'm going to run through some of the logistics, I guess, of setting up your clinic, and I guess set the scene for the things that you should be thinking about at the moment. In these early stages, and while we're all sort of still getting information filtered through in bits and pieces from the government, it's potentially on everyone's minds about where they might need to be starting. And the EOI process is a really good reference to go back to. Your EOI or your RFI checklists, they actually outline the requirements that needed to be met to be accepted for an EOI or an RFI. And that's a really good place to start, to go back and to run back through all those requirements and ensure that your practice is actually meeting those. So this will help you to think about your space. So to think about what part of your practice that you're going to be using to setting up your clinic, and understanding that all practices are doing different things for this. Some practices are setting up small scale clinics where they might be using a part of their practice, and some practices are actually nominating whole buildings that they're going to be using for vaccination. So this might be really individual to the space that you're using, but the elements need to be the same. So you need to think about the flow of your clinic and the process that you're going to run patients through when they get vaccinated. And I'm sure that you're all trying to work out the most efficient way to do this, because we all know that with the number of people that we need to vaccinate, efficiency is going to be the key. And standardising the process is a really important part of this. So I've just included here a New South Wales health resource. It's a larger scale flow, but just to sort of get you thinking about the different spaces that you might be using for your practice. And we can share this with you so you can have a look at what's happening. New South Wales Health have also kindly offered to support any vaccination clinics. The Public Health Unit is happy to discuss flow and logistics, infection control with you guys if you're you have wider questions about your clinic. So that is on offer for all general practices, and we can facilitate that for you if you would like some more support. So you need to think about the infrastructure. You need to think about your consumables and your waste. How are you going to deal with the large amount of waste that's going to be generated by the vaccination process? Think about your workforce and your workforce capacity. How will you upscale or downscale your workforce according to your appointments? And this is going to be something that's going to take some time to understand. Clinics at the moment are wondering about appointment bookings, about the demand that they're going to face for vaccinations. And this will probably only become apparent over the first couple of weeks of actually vaccinating. So it's something that you're going to have to monitor. But be thinking in the back of your mind about contingency plans for staff. Staff will need holidays, staff will get sick, staff will be delivering vaccination after vaccination, and they may become physically or mentally fatigued with the process. So have some contingency plans in place for how you're going to manage your staff through this process. The other thing that you need to be thinking about is patient readiness. So how are you going to get your patients ready for the COVID vaccination? And it's fairly apparent that patients are already ready. Patients have already started asking questions, contacting practices, wondering how to make appointments. So it's important that as a practice, you have a really consistent message. And this is going to take some work with all of your staff to be able to ensure that from the front end of your practice right through to your clinicians, the message is consistent, that people understand what the process is and who qualifies for vaccinations. So think about your communication strategy with your patients. How do you communicate with them now? Do you send them emails? Do you send them text messages? Do you have updates on your website? You probably need to start to think about the ways that you're going to be communicating this with them. Something that I would like to draw your attention to is the fact that there is some rules around advertising COVID-19 vaccines to the Australian public, and these can be found on the TGA website. So I'll share the link with you, but it's really important that you consider the language that you use. The resources that you use to advertise need to be government approved ones. And there is some examples of social media tiles and also some releases that you can use that have been approved by the government and the TGA. So just be aware that this is regulated, and we have to be careful about the information and the claims that we're making when we're advertising this to the public. In visiting practices, one of the big things is there's very common questions that keep getting asked over and over again. So prepare your key FAQs and prep your staff with them. Your admin staff are going to be phoned, your clinicians are going to be questioned about the same things over and over again. Who's entitled for a vaccination? How do I make an appointment? When do I need to make my second appointment? And probably questions around the safety and the efficacy of the vaccine, which is probably more in the line for your clinicians, but also about objections to vaccinations. And this is something that has come up a lot in conversation as well. It's probably good to start thinking about some resources for conscious objectors, people who don't want to be vaccinated, and some key answers for yourself or for your clinicians around people who have questions regarding vaccination. Because as we've seen, it's quite high profile in the media. There is a lot of controversy, I guess, and there's a lot of speculation about the vaccine. Some of the best places that you can go for the facts is the World Health Organization has a really good web page that you can get resources from, which I'll share the link. There's actually a CMI, so a Consumer Medication Information Sheet, available on the TGA website that you could definitely provide to patients, and that's designed to be in their language. And there's also resources on the TGA website. And my advice around this would be to keep it evidence-based and keep the conversations factual. Within your practice and with your staff, keep those conversations the same. Offer vaccinations to your healthcare workers, but again, it's not mandatory and nobody's under any obligation to be vaccinated. So this might just give you some places to go to for more information. And the consenting process is going to be another important factor for your practice, because everybody has to consent to the COVID vaccination. There's some exceptional resources available and there is templates for this, but this is going to be a key time-consuming factor in running your clinics. So it's really important that everyone's aware of the consent process. ATAGI, which is the Australian Therapeutic Advisory Group for Immunisation, has put together some information on how to consent patients for vaccination, and there's some really good resources on the website that's run by the Australian Immunisation Handbook. So all of these can give you really good processes for clearly consenting your patients to vaccination and keeping records. And the thing just to be careful, to be thinking of as well, is the readiness of your staff. So Fallon will talk more about the training of your staff, but just make sure that their training is up to date, their CPR and first aid is up to date, that you've run through scenarios potentially around emergency situations with your staff, so that if there is an anaphylaxis or an adverse event, that your staff are prepared and ready. Train ancillary staff, so it's important that everyone has training, not just the clinicians. Be ready with your frequently asked questions, and as I said, keep the messaging consistent. Have staff meetings about your COVID vaccination pre and during, and keep an eye on your staff, because I imagine, like testing for COVID and like the work that we've done previous to today, this will be fatiguing and will be a large burden on your staff, so check in with them. From a PHN perspective, to support your clinic, we're actually implementing the capacity tracker system, and you may or may not have heard of this by now. The idea behind this is capacity tracker is designed to be an emergency response tool. And with the COVID vaccination, the way that we can actually support you is through having you input into the system anything that goes wrong along the way. So if you have a workforce shortage, if you have a vaccination shortage, if you have a fridge or a power out, if you have any issues affecting your ability to vaccinate, it's actually captured in this simple one page. And then we can assist, we can respond and assist you guys if there's an issue that's going to stop you from being able to continue to vaccinate. We are offering sessions to help you get this up and running. It's very simple and it's all available online. But the other benefit from this is we're going to be able to see where vaccination sites are. And as you can imagine, at the moment, we're cobbling together sites between the respiratory clinics, general practice and our AMSs, and to be able to give this information to other clinicians and to our consumers that are looking for places to be vaccinated, we have to have a really good idea of where these centres lie and how they're operating. So this is actually going to help your consumers when they're seeking out a place to be vaccinated. I'm now going to hand over to Fallon Gray, who's the Manager for Practice Support and Improvements, and she's going to go through some of the logistics from a practice perspective. Thanks, Fallon.
Thank you, Tab. Can you hear me okay?
Can.
Wonderful. So my name's Fallon Gray and I'm the Manager of the Practice Support and Improvements team based in Bathurst, but I do have a team of practice support officers across our region. Our goal is to support all the general practices and the ARCHOs in delivering the best patient health outcomes through engagement, continued support and quality improvement. So don't forget to contact your practice support officer or myself if you do need support around the COVID vaccinations or any other practice support. Today I'm just going to talk about accreditation, MBS Billings, training and the PIP incentives, and also just mention some of the PenCS recipes that are available. So the I've also just got some links on these pages as well, but as we mentioned, the slideshow will go out. Thanks, Tab. Next slide. So in regards to accreditation, all of the COVID-19 vaccination clinics that have applied are all accredited sites already, so that's a given, and we will play a crucial role in the administration of the COVID vaccinations. I've just got a little bit of a screenshot on the right of the focus areas that we will need to ensure that we are communicating, upskilling and socialising in all of our staff meetings at the moment in the wake of the COVID vaccination rollout. Just remember that these are policies and procedures that we already have in place in our facilities and that our staff are already aware of, but it is timely that these particular set of standards are, as I said, communicated and really clear to everybody. And if you do have any new staff or any staff that are nervous or anxious about any of these policies around the vaccination rollout, please contact us and we're more than happy to come out and help you with that. We've also got some links on our website from the RACGP, AgPal and QPA websites. The GPs and nurses and practices that are providing the COVID-19 vaccines are also strongly encouraged to contact their professional indemnity with any inquiries that they might have and have a chat to them about coverage and questions and concerns. Next slide, thanks, Tab. In regards to the MBS Billings, there have been 16 new MBS item numbers made available from March this year to eligible GP practices. When I refer to GP practices, I just wanted to note that I'm actually referring to general practices and ARCHOs. So the 16 new MBS item numbers are available on the MBS online website. Again, the link will be made available to you all. I've just got a screenshot of that as well on the right-hand side. So the item numbers that you can bill are dependent on your modified Monash model. If you are unsure of your modified Monash model, the link will be available for that. And there are different item numbers available for during business hours and after hours vaccinations, depending on the model that you decide to roll out. All of the COVID-19 vaccine MBS item numbers will be billed under a supervising GP. So in the same style as the MBS Billings that we bill day in, day out, you need to make sure that the supervising GP is on site and make sure that they accept full responsibility for the service that they are billing under their own provider number. There is a list of, I think I've already said that, but there is a list of the COVID-19 MBS item numbers on our website, as well as on the MBS online website. Thank you, Tab. In regards to training, the vaccination itself can be administered by a GP, a registered nurse, or other suitably qualified health professionals that are registered under the health practitioner regulation law. If you want clarification around that, please refer to the Department of Health website. And it's also important to note that all of the staff that are administering the vaccinations have done the online vaccination training program on the website as well. And I'd probably get onto that soon so that we're prepared for when the rollout comes to our region. Thank you, Tab. In regards to the practice incentive payments and the COVID-19 vaccine, the news has come out recently that there will actually be a practice incentive payment for vaccinating general practices and ARCHOs. So all of our accredited practices that are providing the vaccination will receive a practice incentive payment in their quarterly payments of $10 per eligible patient. However, to receive that $10 per patient incentive payment, the patient has to have both doses administered in the same clinic. So to make this work best and to be most efficient, it's probably effective that when they have their first vaccination, we make sure that they're set up for the next appointment, or there's a reminder recall system in place to make sure that they are coming back to the same clinic for the vaccination, so that we can ensure that there's nothing getting missed in continuity for that patient, and that there's the incentive there for the practice in doing that work. Next slide, please. All of our practices that are QIPIP registered across our region have free access to all of the PenCS products. So I know that you're all familiar with these products. They've updated their website and put several different resources on there. By resources, I'm referring to some PenCS recipes. So a recipe, for those of you who aren't familiar with the term, is how to run a filter in the data extraction tool to have a look at a certain patient cohort. So in this instance, we'd like to find our high-risk patients so that we can identify the patient cohort that need to come in first for the COVID vaccination. So all of these pen recipes to identify the patient cohorts that are most high risk and going to require the vaccination first are on their website. Just again to remind you that this is something that we can come and help you to do. You are not alone in doing this. So if you would like the practice support team to come and help you to identify these patient cohorts, we're more than happy to do so. The PenCS website have also uploaded several training videos and webinars as well, which are quite useful, and includes things like the recipes and patient identification, but it also looks at how we can use top bar better during this process. And there's also some triaging for patients that are at risk of COVID vaccination, of COVID-19 as well. And again, the resources will be available on our website. Thank you, Tab. I think that's all my slides.
Beautiful, thank you, Fallon. That was really great. I'd now like to hand over to Claire Trott. So Claire is our Manager for Digital Health, and she's going to talk about some of the technology that's going to support your work setting this up and going forward.
Thanks, Tab, and good evening, everybody. So just wanted to alert you, I guess, to some of the digital health considerations that you might want to consider prior to the vaccine rollouts, and just essentially get on the front foot as far as it goes. So the things to consider is certainly your Proda account, your delegations, and whether or not you are planning on utilising an online booking platform, such as HotDoc or Appointuit or Health Engine. Next slide, please, Tab. So your Proda account is essentially a very key part of the vaccination process. So being that all of the practitioners within your practice will definitely need to have their own individual Proda accounts. And I know that that's not necessarily something that is in place, but certainly as far as the vaccination process goes, and making sure that you have got your own individual Proda account so that you can arrange delegations to another individual that might that will be acting on your behalf. So for a practice nurse, for example, to access HPOS and the AIR, you definitely need to have your own Proda account and have those delegations set up. So it's really important to remember that your delegations will only last for 12 months. So I would strongly encourage you to ensure that you check to make sure that your delegations are still current, and if they're not, ensure that you can update it. So the Australian Immunisation Register, you can access that via HPOS, which is also through your Proda account, and the patient's My Health record. Next slide, thanks, Tab. Online booking platforms. So as I mentioned, your HotDocs and your Health Engines, which we do know that a lot of our practices in our region do already utilise. But those online booking platforms have been very, very quickly introducing some functionality to assist the practices with the COVID-19 vaccination. So they've introduced features such as patient eligibility screening when they're making the appointment, multiple provider bookings. So in the instance where you might be running a nurse-led clinic with a GP in the building, the online booking platforms have the ability to book 2 providers at the same time. Also ensuring that you can book multiple patients in for one time slot. And certainly something I think that would be very important in your workflow is that they are also integrating the digital consent form. So that will assist in ensuring that you don't have to have paper copies in the practice prior to the patient's vaccination. Inventory management, they are integrating with AIR, and they have a directory of COVID-19 vaccination centres, and then also have the pre and post appointment communications to the patient around their vaccination as well. Next slide, Tab. Oh, that's Michelle. Sorry, that's me. Thank you.
Not a problem. Thank you, Claire, for that. So I'm now going to introduce Michelle Drewler. So she's actually our immunisation officer. So she does all things immunisation and is super busy right now with this, but she's going to talk about some of the vaccination logistics that you should be thinking about to keep your vaccinations and your patients safe. Thanks, Michelle. You might be on mute, Michelle.
Sorry, I was on mute. You are quite right. Can you hear me now?
Sure can.
Oh, good. Thanks, Tab. Well, cold chain management. So the AstraZeneca vaccine, it requires the same standard temperature that you're used to with the between 2 and 8 degrees and striving for 5. The national guidelines have got all the information in there. So, and there's a link to that on our website if you're not familiar with the Strive for 5. It might be a good idea if practices haven't done so already to do a vaccine fridge audit, a self-audit, and that's supposed to be done each year, and that will help you to sort of identify if you've got any areas that need to be tweaked before you receive any AstraZeneca vaccine. So basically with your data logger, you need to download that each week and store that. You may never be asked to produce that, but if public health do want it, you need to be able to produce that. So, and they do random audits, so make sure you've got that downloaded each week and stored electronically. You need to have an external digital thermometer in your fridge. So that's a thermometer that's on a lead, and the probe sitting inside the fridge is close to your data logger that you can get it. Also, to have a purpose-built vaccine fridge. There's to be no standard fridges at all, just to make sure you've got a purpose-built vaccine fridge, and that you record your temperatures twice a day. And don't forget to reset the gauge every time you take your temperature, the fridge temperature. Make sure you reset that gauge. So the acceptance, so when you receive your COVID vaccine, you have to report the acceptance form that day, and it's to be in by 9 p.m. that night to the Vaccine Operations Centre. And if there's any problem with the cold chain during transport, there's a separate form that you'd fill in for that. All staff that have anything to do with the receival or anything to do with the vaccine need to do the cold chain module on the New South Wales Health website, which the link to that is on our resources page. Your cold chain report it to the Vaccine Operations Centre, and all clinical concerns still need to be directed to the Public Health Unit, and everybody's got that phone number. But if there's if you've got any cold chain breach with the AstraZeneca, you do report that to the Vaccine Operations Centre, but most practices will still have their usual vaccine, their NIP vaccine. So you also need to make sure you report through to the Public Health Unit as well if you've got any breach in the cold chain there too. That's all. Thanks, Tab. Oh yes, I talked about that. The form, the vaccine stock management form, that has to be submitted by 9 p.m. each day if you've got any COVID vaccine stock in storage. So by 9 p.m. every evening, you must do your stock take. If you've got any cold chain breach, you need to return. So if it means taking your vaccine out and putting it into another fridge, or to pack it into an esky, you've got to try and return it to the cold chain as soon as possible and isolate it, and don't use it, and notify the Department of Health, and don't discard any vaccines unless you've been instructed to do so by the Vaccine Operations Centre. The vaccine wastage report must be completed where there's a wastage that exceeds the threshold of 5 or more vials in one incident, and all other wastage must be reported on the daily stock take management form. The multi-dose vials, I think they've got around 8 to 10 doses. I think there's 0.5 ml in a dose, and so you might have a little bit left over in your vial, but you can't mix 2 different vials to form 1 dose. So just once you've got only a little bit left, then that's it. You don't use that to make up another dose from another vial. Just discard that. So I think that's all there, Tab. The adverse events following immunisation. So the Therapeutic Goods Administration, they work closely with New South Wales Health and the Public Health Unit, along with the National Centre for Immunisation Research and Surveillance, which coordinates the AUSVAC safety data, which reports back into the Commonwealth as well. So I'll talk a little bit about the AUSVAC safety, but any non-serious and expected adverse events known to be associated with AstraZeneca, so that might include things like pain at the injection site, or a mild fever, or the person might feel a bit tired or have a bit of a headache. The public health don't need to be notified of those adverse events. But if they're worsening, that would be a notification, or anything that was serious or unexpected or with severity or duration, they need to be reported through the public health. And and there's all, if that's during business hours. If it was after hours and it wasn't, you didn't need management or clinical advice, you could fill out the Ministry of Health COVID AEFI form. You're mandated, we're all mandated by public health to report any uncommon, unexpected, serious or significant adverse events following an immunisation. And if you needed any investigation or management advice, clinical management advice, you can contact the New South Wales Immunisation Specialist Service. They're based down in Westmead, and they've got an 1800 phone number, 679477. That's during business hours. If it was after hours, you can contact the Westmead Hospital switch and ask for the to be put through to the after hours for the immunisation specialist service, and you'll be put through. You can still get clinical management advice after hours, so that's important to know. And also important to know that you can always contact them, the immunisation specialist service, for other vaccines as well. It isn't just COVID related, but they're a fantastic service. Yeah, so thanks, Tab. Patients that wish to self-report if they've got any concern following their vaccination, they can do that through the AusVac Safety if the practice participates. And that's a link that I'll give you, that, yeah, for the practice, they have to register to participate in the AusVac Safety, and it's led by the National Centre for Immunisation. And funded through the Australian government, and that's a surveillance that's done via a text message that the patient gets within a few days of receiving a vaccination, and it's just a brief survey of if they've had any adverse event, any concern at all, and it's a yes or a no, and if it's a yes, then they'll be prompted through to a few more questions until there's some, yeah, that's then reported back up through the Commonwealth. It works by the person receives, yeah, at a participating clinic. We have got practices that participate across our region. There's over 300 across Australia, and there are some across our region as well. It syncs in with most general practice software. I don't know about Communicare or Genie, but definitely with Medical Director and Best Practice. And then the surveillance tool is syncs in with the practice software, and then the person gets a text message, and it's very easy to operate, the functionality. Yep, so that's AusVac Safety. You can order these reports from the AusVac Safety. That's a 2-month, yeah, all the adverse events from a 2-month vaccination, 18-month, at all the age groups for the NIP vaccines, you can get them. And they've started one now for COVID vaccine. I think I've got a report on the next page for the COVID vaccine. And that's the safety data as of the 3rd of March. And this would be the Pfizer vaccine. There were 11,000 surveys across Australia with close to 70% response rate, and only 0.7% of people had to visit a doctor or an emergency department following their vaccination. So yeah, I think that's really all for me. And if you wanted to look at, yeah, if you wanted to look at AusVac Safety, there's the link there, and you can just yeah, go in and see if you'd like to participate as a practice. But the beauty of having AusVac Safety, the data will start to sort of help consumer confidence in the vaccine, because they can see that that for the number of people that have been vaccinated, the adverse events are very, very extreme, you know, very low, and it will also build provider confidence as well. So yeah, so that's it. Thank you.
Thanks, Michelle. That's excellent. So we're through the information part of this evening, and we wanted to leave some time at the end for questions. So now's a really good time to ask any questions, because you have got the Brains Trust here that can answer them. I'm just going to run through the chat box and see the questions that we've had asked so far. I know that everyone's asked for the resources because some of the pictures were too small, and yes, we will definitely send out the presentation and the resources after this so that you can have those, and they will be on our website. and they will be in the resources section on Capacity Tracker, so there's lots of places that you can access those. Somebody has asked for a link to Strive for 5, and if you don't know what Strive for 5 is, it's on the New South Wales Health website, and it has all the national guidelines for vaccine storage. It has training for your staff. It has resources that you can put up on your fridge. It is an exceptional website, and it really should be your go-to place when you're looking for resources around educating your staff on cold chain management. So the 5 is related to cold chain management. Just a question from Nadine. Hi Claire, is the new immunisation format up and running in My Health Record? Claire?
Thanks, Tab. So yes, I can confirm that the My Health Record system was upgraded 2 days ago. So yes, it is.
Beautiful. And just while we're talking about My Health Record, we have had questions from practices who aren't vaccinating, and they're asking what they can do to support their patients that are getting vaccinated at other practices. And one thing to think about is uploading a health summary to their My Health Record, so that if they do present to a different place for a vaccination, some of their details can be checked and it can assist with the process. So it's something just to think about in supporting the practices that are vaccinating. Another question from Nadine, for Michelle, just to check, our vaccination fridge has a wireless logger, a data logger, and a built-in minimum maximum thermometer. We do not use a portable thermometer. So is this acceptable, Michelle?
Thanks, Nadine. No, you will need to get an external digital thermometer as well that's on a probe. So that's, yep, you will still need to have that.
Thanks, Michelle.
All practices need to have that. I can send an example to Nadine if she wants one. They cost around about, they vary between about $40 and $80, but I can send a link if you want one.
Thank you, Michelle. We might add that to our resources so that everybody has it, and you can make sure that you have the correct equipment. Just a really great question for Alex. And Alex, I'm going to hand over to Sonia Berryman just to give everybody an update of where we're up to with the rollout of phase 1B. So you've asked, is there any estimated start date in Western New South Wales? Sonia, can I just hand over to you to give everybody an update about where we're at with this?
Sure, Tab. Thank you. I hope everybody can hear me. I just thought I'd give an update on where things are at. Like Tab said, at the moment, we as the PHN are just waiting for the Department of Health to send us a spreadsheet. So that spreadsheet will have all the eligible practices on it, and it will tell us which week, from week 1 to week 4, that each practice has been delegated to. And then once we get that list, we'll be sending letters out to every one of the practices to let you know where you fit. With that will come an onboarding pack. Part of that onboarding pack will have a declaration form that you will need to sign and send back to the PHN in a very quick turnaround. That turnaround could be just 24 hours that we may need that back. So keep an eye out for that email with that information. The onboarding pack will give you all the information that you need to commence your vaccination program. We will hopefully have that to you. We thought we'd have that out to you today, but sadly the department hasn't sent that to us yet. So hopefully we'll be able to send that to you tomorrow. If it's not tomorrow, it'll be early next week. So like I say, that will give you which week of the vaccination program that your practice has been allocated to. The department has done that based on many different factors, based on what you've put in your EOI, to your throughput of numbers, and your capacity of staff. So they have done that, and like I said, they'll send that out to us. You should get more information around that, like I say, in the next day or so. I'm really sorry. I really hoped that we'd have that out by tonight's webinar, but it's been delayed. With that, we'll also give you an indication of how many vaccines you'll be allocated each week based on a small, medium or large practice will be given anywhere between 50 to 400 vaccines. And there'll be some information around reordering, and you can't reorder until you've actually used the initial dose, initial amount that you have delivered, but there'll be more information around that in the onboarding pack. I'm sorry I haven't got more information, but at least you know it's coming within the next few days, and potentially the rollout will happen in the next couple of weeks. So thanks everybody.
Thank you, Sonia. So I'm just going to keep moving through the questions because they're coming in still. So Dr. Jacobs has asked about getting a printout of the patient's health summary, and this might be something that does need to happen for patients who we don't have access to a digital health record to share a health summary, because there are some components of this that might actually help with their eligibility for the vaccine. This is probably something that might need to be worked out practice by practice or town by town. And this is one of the things that I would be encouraging you to have conversations about between practices. If you're not an immunising practice, then you might want to have a chat to some of the practices around you that you're thinking about sending your patients to, or the respiratory clinics, about what process that they're going to need to be able to vaccinate your patients. And vice versa, if you're an immunising practice, it might be worth thinking about what your process is going to be for, one, establishing information about your patient, but also to feeding back about patient vaccination. So I don't have a model yet. I sort of haven't got that far, but I'm happy to share any information I get while I'm out and about talking to practices about the different models that they're thinking about using, but it probably requires some local conversations as well. Alex again, is prioritising within 1B up to the practice, or is there a recommended order? And it's a really good question. Everyone that falls within 1B is equally as entitled to a vaccination as one another, but logistically we know that everyone can't be vaccinated at once. So it's really important that I guess you have to start somewhere. So if it's not driven by the public, so you might say, you might be getting appointments and you may not be looking for additional patients, but if you're going to start to look for patients either through PenCat, contacting your own patients, then you may have to start somewhere. You may have to choose a group and you may have to start with them, because logistically it's impossible to probably get all of your 1B patients booked in for a vaccination all at once. So it's probably going to come down to having to have some sort of process that your practice adopts. But essentially, everyone is as equally entitled to be vaccinated. It's just a numbers situation, I think. I'm just going to hand back over to Claire now. She wants to just talk a little bit more about the shared health summary. So Claire, over to you.
Thanks so much, Tab. So yeah, look, just in answer to Dr. Jacobs' question in regards to the printout of a patient's health summary, I think that it is quite important, and of course you've mentioned it yourself, that you know, so the patient eligibility ultimately, particularly if you're using an online booking system, is self-reported. And part of that process is going to have to be for the GP to discuss those eligibility criteria. So if there is a shared health summary for that patient, then obviously you would be able to access it through the patient's My Health record. But we are getting approached by practices to say, what can we do to support the practices that are vaccinating if they are an ineligible practice? So I think that there's certainly some work that we would be able to assist with the ineligible practices on how they can actually facilitate that for their patients. So I do think that that's something that we will be addressing in the coming weeks. Thanks, Tab.
Thanks, Claire. So I'm just going to go back to the question. So Nadine, is there a link or a list of specified medical conditions for Phase 1B? The information about Phase 1B is all on the New South Wales website. I haven't seen a list of specific medical conditions, but there is a couple of FAQs that have come out since that information. I'm just going to ask if anyone else on the panel knows this, or if it's something that we need to get back to you about.
We'll get back, Tab. It's Sonia. There has been some lists being thrown around, but nothing official yet.
Beautiful. And this stuff is evolving, like it is evolving day by day. So we will continue to try and get out the information to you guys as we get it. Question from Sue Russell. Do we need to put aside the number of vaccines given in one day to ensure that the people receive the second dose? And so that decreases the number of vaccines per week. Michelle, are you still there? Do you want to talk to that one?
Am I on mute?
We can hear you.
Oh, good. Sue, that's a really good question. And to me, I think really with the AstraZeneca, it's what dose, like dose 0, and then 12 weeks later, it's your second dose. So I'm thinking that if you were storing vaccine for 12 weeks, it's going to be quite, like, you're not going to have enough fridge space. So to me, that's not really reasonable, but I think that we'll know more in the coming weeks. I think there'll be guidance around that coming out from the Commonwealth once they've got, you know, a strong and steady vaccine supply. They're confident that they're going to, you know, you'll be able to get weekly orders and things like that. So I think that we'll know that. I think it's all just still too hard yet to say definitively, answer that definitively, but I would think it wouldn't be reasonable to hold vaccine for 12 weeks for everyone.
Michelle,
I don't think so.
Can you hear me?
But I'm not sure.
Yes, we can hear you, Robert.
Yep. So that question was asked today at one of the sessions I was at, and the department had an answer, but basically, because you'll be booking your patients in, you won't need to hold a vaccine back, and we won't initially, but we will get to the stage where you'll still be vaccinating people in 1B, and you'll be looking to book people in for their second vaccination. So you'd probably be wanting to, you will find out that you're going to get a steady number of vaccines every week. Many practices will get something like about 100 doses a week. Some will get more, some will 400, some will get 50. But the department will make sure that that is what you've got available to you. If you can't handle the number that you're being offered, you can say we want less. If you can handle more, you can also, once we get rolling, make an application to say we want more. But as long as you are booking people in, you have control to be able to say, okay, first vaccination, we'll get you booked in. Okay, in 12 weeks' time, we'll also book you in. And that's to your advantage.
So Robert, oh, sorry.
Go on.
I was just wondering, so with the stock take, like the practices will be doing a daily stock take. So is the department going to look at that daily stock take as to how many vaccines that were used in a practice, and they'll do an automatic order? Are they going to distribute according to how many vaccines a practice has used in a day or a week?
Yeah, so I don't know if it's automatic. I think there might be some manual intervention. And as you mentioned, if you haven't used your vaccines, they're not going to be keen to be sending vaccines out.
Yep.
But that's the best answer I can give you at this stage.
Yep, no, that's good. Thanks.
Thank you for that. I've just got one more question from Eunice. Are we still required to keep the second dose? So I think we've just answered that for you, Eunice. So that's one of the things that's evolving, but it seems that we don't. And just while we're talking about that, so Capacity Tracker will actually help you with your daily inventory for your vaccine and keeping track of any that you have on order, so that you can see how many you have and how many should be coming. It gives you a recommended guide of having 100% for the next 10 days of vaccination, so that you can try and have a good stock control process going, because as I mentioned before, this is only going to be something that you're going to understand better after you start vaccinating and you see what your capacity is like to vaccinate people, and that's going to depend on the timeframes and the efficiency of your clinic, and also the stock that you're going to be given to be able to deliver vaccines. So that might be a limiting factor as well, or maybe it might be too many when you get started. So it's probably going to be an evolving situation, and having a really good process for stock checking your vaccines and ordering your vaccines is going to be really crucial to keep those available for your patients in the required amount. So I think that might have gotten us to the end of the questions. No, one more from Oliver. How about those eligible patients with medical conditions but are visa holders? Are they able to get the vaccine as well? So just so that everybody knows, everybody who is in Australia is entitled to a free vaccination, except, of course, at the moment, children under 18, because we don't have the data to vaccinate them. So people who do not have a Medicare card can go to a respiratory clinic to get vaccinated when they're an eligible person, and they can also get vaccinated through New South Wales Health. So that will be the two avenues that they can access a free vaccination. So it's also important to get that information out to people who may not be Australians or from overseas living in Australia, or who don't have a permanent status here. So we are able to vaccinate everybody. So I think that it's important that that message is out and about for anyone who might be concerned. Another question from Dr. Mel Mateo. Our clinic is small, so will we have to wait to move on to the next phase? Are you talking about phase 1B? So what will happen most likely is that phase 1B will start, and at some sort of determined time, then we will move into the next phase, and you're probably going to find that the phases will overlap one another. So the next phase is tipped to start around May, and that's when pharmacy will come on board and be able to vaccinate as well. But I don't think there's going to be a delineation between the first phase of vaccinating people and then moving into the next one and then into the third. I think that it's going to become a time where we will have crossover between all of them. But the government is going to identify the rollout within general practices of who will be put, I guess, in the first week, the second week, and so it will roll, so that it's a rolling process. But we don't have any more information about that at this time. I think it will probably be around maybe access, because we have to try and have facilities right across our region to get access for everyone to have vaccinations. People, yes, Pawan, people who have no Medicare card can go to respiratory clinics and New South Wales Health clinics. That is absolutely correct to get a vaccination. Sunil Jacob said not all respiratory clinics. Sonia, do you want to comment on that at all? About respiratory clinics' ability to vaccinate people with Medicare cards?
Sorry, Tab. The only information we have at the moment is what you've said, is that respiratory clinics and New South Wales Health are the avenues for those that don't have a Medicare card at the moment. That's the only information we have around that. And just in regards to the different phases, the reason that phase 2 won't start immediately is because of supply of the vaccine. At the moment, we only have the amount of vaccines that have come into the country from overseas, and until we start manufacturing our own, that's when we'll be able to ramp up into phase 2.
Thanks, Sonia. And if you want to understand more about the phases and how that was determined, again, ATAGI wrote a really good guide, the evidence around prioritising different populations. So that's where the government is really setting their phases around, is the evidence and the value of vaccinating the different populations. So you might be able to find some more information there as well if you're looking for something to have a read of. Where, just a question, where will be these clinics? So if you're looking for a respiratory clinic, they're located in Bathurst, Orange, Dubbo, Cowra, Mudgee, Cobar, Walgett and Broken Hill. Those are on our website, and they're also on, if you have a look online, you can book an appointment through an online booking portal on Health Direct, so they're accessible to everybody. Another question is, how long will this program go on for? That is a really, really good question, and I don't think that that's one that we have an answer to at the moment. I think that this is unprecedented. This is something that we've never had to do before, and it's a complex rollout of a vaccination with a booster. So I think that we're just going to have to watch and wait. The government has set a target, but I think it's quite ambitious. So I think we're just going to have to watch the numbers and better understand how we can vaccinate in our region and try and, you know, have an understanding of how long it's going to take us to look after our populations. Another question is, I see a patient in the nursing home. Should I just have the vaccine rather than wait for vaccination? Look, that's a really good question, Mel. We are unsure as to how fast we are going to have access as health professionals to vaccinations. They still haven't started up in our region for health professionals specifically. If you do have access to vaccinations within your practice, then you might make the choice to vaccinate your staff with the AstraZeneca vaccine. That's always an option. I guess it's another one of those watch and wait situations to see when that's going to be available. There is a 1A rollout for certain frontline medical staff and clinicians. And so that will be the first portal for healthcare professionals, but that hasn't started as of yet. So it's probably one of those watch and wait and see what's going to be your best option and your speediest option when the time comes. A question from Eunice. Can we advise patients without Medicare cards to apply for IHI number with Medicare, which will give them a HPI number which practices can use to upload into the AIR? I'm going to defer this question to Claire because she's the person with the digital knowledge. Claire?
Thank you very much, Tab. So you actually cannot apply for an IHI unless you have a Medicare card. So that's the answer to that.
Beautiful, thank you. And I'm aware that it's 8 o'clock, so please don't feel like you have to stay. I'm going to answer this one last question, and feel free to send more questions through to us afterwards. We're happy to answer questions on the email as well. And before you go, can you please give us some feedback, because we're running this session 3 times, and if there's something that we've overlooked or we haven't addressed, it'll be wonderful that you gave us some feedback so that we can tailor this to the next sessions and make it as relevant as possible. Just one last question I'm going to quickly get to is, sorry, the Pfizer vaccine second dose is in 3 weeks and AstraZeneca is in 12 weeks. I might just defer that to Michelle. Are you still online, Michelle?
I am, and that's my understanding. Yes, that's correct. Pfizer 3 weeks apart, and yeah, the AstraZeneca 12 weeks. It can be given earlier than 12 weeks, depending on the person's individual requirements, but at the moment they're saying 12 weeks.
Excellent. Look, thank you again, guys. I really appreciate your time. I know that everyone's busy, and this adds another complexity to everybody's workload. So thank you for coming along this evening. If you are looking for information on the particular vaccines, the TGA has product information sheets on their website as well. So they do get updated, they do change, and they have changed as vaccines have been rolling out across the world. So if you are getting information, keep it online. Don't print things and then go back to them, because it does change very quickly. So a big thank you to everyone in the PHN team who's come along tonight, and thank you to you guys for listening. By all means, contact us if you have any questions. We're here to support you through this, and good night.
Good night. Thanks, Tab. Thanks, everyone.
Thanks, everybody.
Thanks, Tab. Thanks, everyone.